اليوم عندنا محاضرة واحدة فقط تقدمها لنا إن شاء الله دكتورة سلمى عبدالوهاب عثمان. دكتورة Salma, she is a community adult psychiatry consultant and she is an associate medical director. She is an examiner, CASC examiner in the Royal College of Psychiatrists of London, and she is practicing here in the UK in Newcastle. Dr. Salma will talk about capacity, and she has 50 minutes to deliver her talk. Then we'll have around 10 minutes of questions and answers or any comment. The floor is all yours, Dr. Salma, and you are welcome.
شكرا جزيلا دكتور عبد الغني. Me. Can you see my screen?
Yes.
Okay, alhamdulillah. Okay. السلام عليكم. طيب دي أول مرة أنا أدي محاضرة للمتدربين الترينيز في السودان. عشان كده bear with me. اوكي التاسك اللي اخذته او اللي حضرته لكم الليله هو mental capacity, and we're going to aim to go through the capacity assessment and how to assess for mental capacity, and so how to do it, and the different types or the various types of the capacity assessments or types of tasks that we get asked to complete with regard to the mental capacity. I will try to go through some case laws, so it's just because usually like going through examples helps us understand the topic better. فإنشاءالله I'll do my best to squeeze the topic within 50 minutes. عادة هنا بيكون أسبوع للmental capacity training. Okay. Okay, so to start with, what is mental capacity? What do we mean by mental capacity? Mental capacity means our ability to understand information and make decisions about our lives. It can also mean the ability to communicate decisions about our life. So the two main parts is making decision and communicating the decision. Our capacity to make decision can vary, depends on the time of that decision making and also what type of decision that we need to make. يعني شنو? When we are assessing capacity, we're assessing capacity for a specific task, doesn't mean that the person is not able to make decision, and this can be like a blanket blanket assessment for everything. No, it's usually a task specific and time specific. Okay, so who should assess capacity? So where consent to medical treatment is required, the health professional proposing the treatment has the responsibility of ensuring that capacity is assessed. يعني شنو؟ يعني if you're a psychiatrist in your clinic seeing your patient and you think that your patient needs to be on medication and you're proposing starting medication, it is your responsibility to ensure that capacity is assessed. Equally, when a surgeon wants to plan for a surgery, it's a surgeon's responsibility to assess capacity for his patient or the procedure that he is planning to go for. However, quite often we get asked as psychiatrists or our colleagues within mental health, then we get asked to assist the other clinicians or professionals to assist them with the capacity, assessment of the capacity process. because we believe, and most people believe, that we are the experts in assessment of mental capacity, and we should do. Okay, so when we look into when does a person might lack capacity? Person lack capacity if at the time the decision needs to be made, he or she is unable to make or communicate the decision because of an impairment or disturbance in the functioning of the mind or brain. During the lecture today, over the next 50 minutes, you'll find me mentioning or talking about impairment or disturbance in the functioning of the mind or brain, because this is an important part of the assessment of capacity.
Important part.
سلام. أيوة. Can you hear me?
And I think this was a mistake. You can proceed.
Okay. Okay. So as we said, that the assessment of capacity is task specific. If you are asked to assess capacity, your first question should be for what? Okay. So because we often get like calls to say, oh, can you come and assess this capacity for this patient? Okay. So for what? It's task specific, time specific. And there are like a number of factors which can affect the functioning of the mind or brain, and this could including mental illness, learning disability, dementia, brain damage, or intoxication. Here, when we quite often get asked about what about the dependence on drugs or alcohol. Dependence on alcohol or drug is not considered to be a disorder or disability of the mind for the purpose of the definition of mental disorder. However, acute intoxication is not necessarily an exclusion, but we should remember that acute intoxication is temporarily. So someone who is under the influence of alcohol or drugs, they might the function of their mind or brain might be impaired or affected during that period, but we know that it is reversible. So if a decision making is required for that person, it could wait. Just wait until the person is sober, okay, and then assess the capacity. Okay. Then we'll go to move into how do we assess capacity? And this is the purpose of the lecture today. And I'm hoping that most of us will leave here comfortable about how to assess capacity and ready to practice capacity assessments, because this is how it sticks by practice. So how do we assess capacity? So can the person make a decision? If we think no, then we need to find out or confirm if there is an impairment in the function of the mind or brain. If so, then is the person's inability to make the decision due to the identified impairment? يعني شنو؟ يعني if you are when you are assessing the capacity for on a person, and you find that your patient, yes, I know this patient, my patient has schizophrenia, okay, but then when you look into why you think this person is unable to make the decision, or the impairment in his brain or mind, it should be explained by the schizophrenia, not by something else. And we will explain this more. Okay. So to assess capacity, we have what we call like the two-stage capacity test. Stage one, we go back to there is an impairment or disturbance in the functioning of the person's mind or brain. Okay, so this is crucial. And this is the first thing that you need to identify first. There is the impairment in the functioning of the mind or brain. Okay, and remember that the presence of psychotic disorder does not necessarily mean that the patient lacks capacity. Okay, so when you are assessing capacity, first, usually you will have access to the person's or the patient's medical records, so you will have an idea about what these they possibly the impairment of the brain or mindset. Is that like cognitive impairment? Then what you might need to do is to do a memory test or cognitive test, either MMSC or A3 or whatever cognitive test that you're comfortable with. And then you need you need then an evidence there is cognitive impairment. If it's a psychiatrist, like a mental illness, then you will do an assessment to find the evidence of the psychopathology that supports the diagnosis, and then this will give you an idea about the severity of the illness or the cognitive impairment or the severity of the learning disability also. So after you know that there is a impairment or disturbance in the functioning of the person's mind or brain, then we go to stage 2, which is a functional test. Here, then we need to answer the third question, remember, that we asked: is the impairment or disturbance sufficient that the person lacks capacity to make a particular decision? I.e., when your rationale or reasoning for why this patient or person cannot make decision, can this be explained by the reason for the impairment in the or disturbance in the function of mind and brain? And to do this, we need to check for these 4 points. And for any psychiatrist, these 4 points, in addition to the impairment of or disturbance in the function of the mind and brain, should be, like a bread and butter, and we should all know them. Okay. So the first point is understand. Does the person that you are carrying the capacity assessment for understand information given to them? Can they retain that information long enough to be able to make the decision? And can they weigh up the information available to make the decision? Can they weigh up the risk and benefit and the pros and cons? And can they communicate their decision back to you? Could be by talking, signing, use interpreter if they need interpreter, writing, okay, any means of communication. Okay. Take an example. You are in clinic. You have Muhammad Saleh as your patient. Your patient has, you've just seen your patient. He has diagnosed with schizophrenia, newly diagnosed. You find Muhammad Saleh presenting with auditory hallucinations. He believed that his next door neighbor, Jaru, he's talking about him. He's planning to harm him. And he's paranoid. He's hearing voices, and the voices are telling him also to harm his neighbor. Okay. Then انت لقيت محمد صالح، قلت لي بعد ما اخذت الهيستوري قلت لي okay, listen, I'm proposing that you to start you on antipsychotic medication, namely risperidone. We're hoping that the risperidone will help with the symptoms, your symptoms, which is the hallucinations and the paranoia and paranoid thoughts about your next door neighbor. Okay. These are the side effects of the risperidone, weight gain, from the side effects, blah, blah, blah. Okay, and you explain them. If you take the medication, then hopefully the symptoms will be relieved and you will see improvement in your mental state. If you don't take the medication, then you will, we're worried that you become more unwell. Okay, you might act on the command hallucinations. You might go and harm your neighbor. It might take longer for you to become well again. Okay, so this is the information given to them. Then you'll ask Muhammad Saleh, okay, did you understand what I just told you? Muhammad Saleh هيقول لك أيوة. هيقول لك okay, can you just repeat what I just told you? Then you're checking the retention. محمد صالح هيقول لك أيوة يا دكتور أنت قلت لي كده كده وعايز تديني دواء والدواء ده عشان أنت فاكر إنه فيه hallucination كده وهناك. Okay. So what do you think? يا دكتور والله أنا ما يعني دواك ده okay. لكن أنت بتقول أنا عندي voices, I hear voices. I don't hear voices, they are real. أنا سمعته، أنا قاعد فيه أوضتي بسمعه هو بيتكلم عني، وأنا عارفه هو عمل كده لأنه اليوم ذاك كان لما لقيته يعني ليه حضر لي، أنا عارفه هو حضر لي عشان كده كده. I don't believe I have mental illness, and I don't think I need medication, and I don't think that I will be unwell or become more unwell because I'm not unwell, I'm not ill, so I'm not going to become more ill, okay? And I don't need medication. So here, Muhammad Saleh's understanding is affected. He's able to retain, and he's able to remember what you told him, like his weighing up is impaired. So his understanding and the weighing up is impaired. He's able to communicate his decision back to you because he had no problem talking and communicating with you. In this case, Muhammad Saleh capacity to consent for treatment, which is a medication risperidone, is lacking. Well, here, then if we go back to stage 1, we know that here, and this could be explained by the reason for the impairment or disturbance in the function of the person's mind or brain, which is a psychotic illness in Muhammad Saleh's case. Okay, so this is how, in principle, this is how we assess capacity, and this applies to all the type of the task or reasons of why, or the subjects of the for the assessment. Assessment could be as simple as what we said, like the example that we've given about Muhammad Saleh. It can be if we tweak the story a little bit, if we say, okay, Muhammad Saleh, okay, says, okay, yes, I can see what you're coming from, and yeah, he has some insight. Okay, yeah, I believe, yeah, his voices, it sounds like they're not real, and I'm happy to take medication if they're going to make them go away. Okay, you understand, retain, he's able to weigh up because he doesn't want to become unwell. So he's able to weigh the pros and cons of his decision making and communicating back. The third scenario could be, I understand that I have voices, and I understand that if I don't take the medication, I'll become unwell. But you know what? I don't like weight gain, and I have family history of diabetes. I don't want to take risperidone. But do you have other options that you can give me? So here he's able to understand, retain, and weighing up. But although he is not happy with what you're giving or you're offering, and he is asking for alternative medication. Here, again, is another example of Muhammad Saleh has capacity to consent for treatment. Okay, so what else do we assess the capacity for? It can be, as we said, like Muhammad Saleh, you're seeing him in clinic and you want to give him to prescribe medication, or could be Muhammad Saleh, he required hospital admission, and you want to assess his capacity to consent for admission, okay, and whether he will again go through a similar situation or similar scenario, okay, and how to assess the steps of assessment of capacity. The third scenario could be is Muhammad Saleh is in A&E or في الحوادث with abdominal pain, where the surgeons wants to they found that he has appendicitis, they want to do appendectomy, and they want to assess his capacity. They ask you to help them. Okay, so انت مشيت شفت محمد صالح عشان مع السيرجن and then محمد صالح قال لكم لا أنا ما عندي بعد ما شرحوا له القصة وحنشيل الزايدة ولو ما شلناها ممكن تنفجر ويحصل لك سبسس لكن لو شلناها حنتفادى السبسس وكده. محمد صالح able to retain، لكن يقول لكم لما نجي للوين اب محمد صالح قال لكم لا أنا عارف ده جاري خدت لي سم في الموية عشان كده أنا عندي وجع البطن، عشان كده أنا ما محتاج عملية. Okay. هنا the weighing understanding is impaired. That's why the weighing up is impaired. But this is another example of assessment of capacity and when capacity could be lacking. So I will then go into talking about the case of Kerry. We have this lady or patient, Kerry Walterton. I can't remember any lecture or talk about capacity assessment that Kerry was not mentioned. So Kerry was a case in 2009 in Norwich, where Kerry attended A&E with overdose on antifreeze. She came but she had an advanced decision to refuse treatment for overdose, and she refused treatment. Just to give you a background, Kerry has she's well known to mental health services in the area. She had personality disorder. She also has depression, diagnosis of depression, history of self-harm with frequent presentation to hospital in the preceding 12 months with similar overdoses. But in the past, she always had accepted treatment. Kerry came with advanced decision written 3 days prior. And this busy slide just summarized what she's written. What she had written was, to whom this may concern, if I come into hospital regarding taking an overdose or any attempt of my life, I would like for no life-saving treatment to be given. I would appreciate if you could continue to give medicines to help relieve my discomfort, painkillers, oxygen, etc. I would hope these wishes will be carried out without loads of questioning. Please be assured that I am 100% aware of the consequences of this and the probable outcome of drinking antifreeze. Example, death in 95 to 99% of cases, and if I survive, then kidney failure. I understand and accept them and will take 100% responsibility for this decision. I am aware that you may think that because I called the ambulance, I therefore want treatment. This is not the case, and that was in capital. I do, however, want to be comfortable, so nobody want to die alone and scared. And without going into details, there are loads of reasons I do not want to die at home, which I realize that you will not understand, and I apologize for this. Please understand that I definitely don't want any form of ventilation, resuscitation, or dialysis. These are my wishes. Please respect and carry them out. And guess what? Her wishes were honored, and she died 3 days later. Dr. Heaton was the treating consultant, and he was on-call consultant that night in A&E. So he's a physician, not psychiatrist. Dr. Heaton felt that she had capacity. Dr. Heaton went and consulted the nursing colleagues, another consultant on the phone, and he sought advice from the medical director, and he also took legal advice. And they all agreed with his decision to honor her wishes and to be allowed to die without medical intervention. Understandably, as they practice in the UK, the case was investigated, and any unexplained or unexpected death goes to the coroner's court where it gets heard. Usually there will be a report from the treating team, and this could get examined by the coroner, the judge there. And the verdict from Mr. Armstrong was the judge: Carrie Ann Walterton died as a result of deliberately consuming a poisonous substance in the full knowledge that death could result. She had capacity to consent to treatment, which it is more likely than not would have prevented her death. She refused such treatment in full knowledge of the consequences and died as a result. Okay, so I know you're all itching there, because we all have lots to say in this case. What is missing here is, unfortunately, Dr. Heaton and his team did not seek up opinion from psychiatrists. This back in 2009, and in reflection, there have been lots of scrutiny from psychiatry and mental health professionals about the decision making in that case. Understandably, so it attracted lots of press, and this is what they was on the Al-Jaraid those days. And more. Okay, so this is an example of when a patient with mental illness known to mental health services that present to the medical team, physicians, and they need to make a decision about treatment. And then ideally, they would have sought assistance from psychiatrists to assess to go through the process of assessment of capacity. Any decent psychiatric opinion would have been questioned whether the patient was depressed at the time when they've written the advanced decision note, and there was impairment, possibly impairment in their mind or brain, okay, that affected their decision making. Okay, so the understanding maybe, so we were not there, but in reflection, this is all possibilities. Okay, so, and we can always chat about this later in the questions, but then I will move on. So we talked about the consent to treatment, consent to medical treatment, consent to admission, and all of that. But there are other types of capacity assessment that we often come across, and there are many of them. Examples are mental capacity to contract. If we change the scenario a little bit for Muhammad Saleh, and so Muhammad Saleh has bipolar. In his manic moments, he decided to take on contract of painting job. قال خلاص أنا بقيت نقاش. With his grandiosity, I will be able to أخلص الشغل بتاع النقاشة for 6 للعمارة 6 طوابق دي في 6 يوم. Okay, I'm ready to sign the contract وفيش مع الشروط الجزائية. Okay, the situation where capacity could be signed, and any other contract. Okay, mental capacity to make a will. Okay, this is another a common example. هل محمد صالح عنده capacity to sign his will? Mental capacity to litigate. You want to go through all the court procedures, to instruct solicitor and all of that. Power of attorney. Mental capacity for assessment of accommodation. Assessment of accommodation, the very common هنا request for capacity assessments هنا في بريطانيا، اللي هو ما في بريطانيا هنا ما في extended family. أغلب في ناس كتار بيكونوا عايشين براهم و because of the impairment of function of mind or brain they might not recognize that they are not safe to live on their own or to look after themselves, to look after their finance. بيخلوا الباب فاتح, very vulnerable, الناس يجوا خاشين عليهم حرامية, ناس غرب يجوا يسكنوا معاهم, ما بيقفلوا البوتاجاز, النار تولع, all of that. So then they insist to live on their own. Then this is when get asked for assessment if they're able to live on their own or they need to be looked after. اللي هو إيواء في يدخلهم دور الإيواء. Okay, so these are the types of the mental health assessment. Dr. Abdelghani, he asked me to go or like to talk about them like in maybe briefly عشان الزمن. So I'll start with the will, mental capacity to make a will. So for men to assess capacity to make a will, for understanding what are we looking for, we want we'd expect from the Muhammad Saleh when he wants to write his will or to make a will, to understand the nature of the act of making the will and its effects. He understand that when he writes a will, ويكتب أملاكه لجاره ولأخوه كويس, he understand the nature of the act, understand the extent of the property of which they are disposing. هل محمد صالح عارف إنه هو عنده البيت الساكن فوقه وعنده 3 بيوت مؤجرة في درمان وعنده كم فدان في البلد وعنده كم عربية وعنده كم? Does he know that? ولا هو بس be writing the will and in his mind it's just only the house where he's living? Okay. Does he know roughly how much his state is? يعني كم الثروة بتاعته دي roughly البيوت دي كم? He doesn't need to know them exactly how much is the market price now, but he needs to know roughly. Okay. And not to be suffering from a disorder of the mind which impairs the influence the above factors or influence the above factors. اللي هو ده بقى جبال زي ما قلنا stage 1 and stage 2 of the capacity assessment. Okay. Can you all hear me? I'm talking to myself. I can't see anyone.
We can all hear you. أنا سامعك على كل حال لكن أعتقد الجميع سامعيني.
Okay, تمام. Just checking.
كلنا سامعينك.
تمام.
ما نقاطع بس ما لو اديتينا المجال كنا عطلناك عطل شديد خلاص لكن
لا بعدين. هاي.
ماسكين روحنا.
Okay.
سامعين.
Okay. So الحاجة المهمة في في الوصية في حاجة مهمة تانية إنه the testator اللي هو محمد صالح in this case must have the capacity both when instructions are given to draft the will and at the time the will is signed, which can create issues where the testator's capacity is diminished over time. يعني شنو؟ يعني محمد صالح نادى المحامي قال له اكتب دي وصيتي وسجل لفلان وسجل لفلان وسجل. At that time لو قمنا حورنا شوية إنه محمد صالح كان بدت معه شوية ديمنشيا. كويس؟ الوقت ذاك لكن محمد صالح had capacity. He was able to make decisions. ما في أي غبار على ذلك. Okay, cognition بتاعه شوية impaired لكن he was able to make decisions. Okay. يلا قام المحامي غطس سافر وشنو هنا وجا راجع بعد كم شهر 6 شهور لمحمد صالح عشان يمضى. ما درافت نفس الكلام اللي قاله محمد صالح ذاك. لكن by that time كان ال cognitive impairment بقى الدهور became worse and then محمد صالح capacity status changed or diminished. محمد صالح لو مضى will D is not valid, the capacity is not valid here because it's changed. ما ممكن يقول لك ده ما نفس الكلام. No. Okay. So this is an important point that you should be remember when setting capacity for will. Okay. I will talk about case law quickly. Okay. So case law, just to explain, this case law from 1863 قديم لكن significant وبتبنى عليه اللو بعد كده الإنجليزي. أوكي الحاجة كان المفروض أقولها إنه الكاباسيتي أسسمنت في السودان how to assess capacity في السودان في السعودية في مصر في UK في أمريكا واحد، لكن اللو اللي هو بعد كده لو الزول ما عنده capacity بنعمل شنو this can differ من حتة لحتة where your practice when you practice in a different country you need to familiarize yourself with the policies and process and procedures and law. طيب Mr. Banks ده John Banks هو he lived not far away from Newcastle where I'm talking to you now from. He lived in the Lakes District. Lake District دي منطقة سياحية فيها cottages يعني country houses or فهو عنده
أكواخ الكوتيج
لا ما هو
كوخ
كوخ ما كوخ ما قطية ما كوخ هو حاجة كده فانسي عرفتها؟
أيوة
يعني
سياحية.
أيوة يعني أنت مش عشان تمشي تعمل لما تمشي تأجر كوتيج دي بتكون مبلغ وقدره يعني. فهو عنده 15 دي بتوريك إنه هو he's wealthy and this is what the message that I want to pass إنه هو كان غني عنده كان 15 كوتيج. Okay ف he has a sizable estate that included 15 cottages in the Lake District. Lake District حتة سياحية. سنة 1863 he decided to make a new will which stated that his estate was to be left to his niece. كتب أملاكه ل his niece. بعد سنتين Mr. Banks اتوفى وبعديها بسنتين his niece اتوفت. قامت يلا her estate which included the inheritance of Mr. Banks مشت لمنو to her half brother who was not not a member of Mr. Banks' family. يعني Mr. Banks مش اداها ل his niece ماتت ورث منه half brother أخوها غير الشقيق لكن ما عنده علاقة ب Mr. Banks. Through Mr. Banks' life, the background ل Mr. Banks, he had seizures, delusions, and had previously spent time in mental institution. هو كان he reported that he's constantly visited by devils and other evil spirits, and he was paranoid about Mr. Alexander. Then, in an effort to have Mr. Banks' will invalidated due to the lack of testamentary capacity, the son of Mr. Banks' half-brother brought procedures to the court. يعني بعد ما Mr. Banks مات وبنت أخته ماتت ورثة وأخوها غير الشقيق لأنه ما عنده علاقة ب Mr. Banks، قام أهل Mr. Banks زعلوا وولد ود أخوه اللي هو أخوه غير الشقيق ود أخوه رجع وقام يعني شكك في الوصية لأنه قال Mr. Banks كان عنده he was mentally unwell so he did not have capacity. هو شكك في capacity. Okay. The court decision that the claim was dismissed and it was determined that Mr. Banks was mentally capable of drafting his will. Although Mr. Banks' delusions were obvious, they had no bearing on the bequest he made in his will. It was established that the test to assess for testamentary capacity is that the testator must understand the nature of making the will and its effect. Essentially, the testator must have the mental capacity to have the awareness that the will disposes of their assets upon his death and comprehend the scope of the asset and give consideration to any claims and must not be impacted by the disorder. So here, then, I would like to refer to one of my very initial slides when we said that the presence of the mental illness, okay, does not automatically mean that the person would lack capacity, unless the decision making and the weighing up is affected by the mental illness. Okay. Okay, so this is about the will. Okay, and I will move to this is my second to last slide, and we'll talk briefly about capacity to litigate assessment. Okay, this is a big, I think a big area, but I'll try to talk briefly about it, and then you might need to go and read, or we can have a discussion about them in the about this in the Q&A. But we'll go through it briefly. So capacity to litigate assessment. This is a capacity to assess the ability to instruct solicitor to go through the court procedures. Okay, it's not the fitness to plead. It is that capacity to litigate assessment, so it's different. يعني شنو؟ مثلا محمد صالح نرجع ثاني كتب الويل كويس؟ مشى they questioning the will, okay? Then you're asked to come and assess Muhammad Salih's capacity. You will be asked to assess two things. You will be asked to assess his capacity to make a will, and also you'll be asked to assess his capacity to litigate, which is his capacity to instruct solicitor or to go through the court procedures. Okay? What it says is that there is no principle either for law or for medical science, which necessarily makes it impossible for someone who has litigation capacity at the same time to lack subject matter capacity. That said, however, it's much more difficult to imagine a case where someone has litigation capacity whilst lacking subject matter capacity than it is to imagine a case where someone has subject matter capacity whilst lacking litigation capacity. I suspect that cases where someone has litigation capacity whilst lacking subject matter capacity are likely to be very much more infrequent, indeed pretty rare. Indeed, I would go so far as to say that only in unusual circumstances will it be possible to conclude that someone who lacks subject matter capacity can nonetheless have litigation capacity. يعني شنو؟ يعني لو جينا مثلا نقول عشان نسهلها أكثر، طيب محمد صالح، إحنا عايزين نقول إنه محمد صالح ما بيقدر to look after himself at home. Okay? محمد صالح ما بيقدر to look after himself at home because of the cognitive decline on the back of the chronic schizophrenia. Okay? And the negative symptoms, he lost the ability to look after himself. He doesn't agree with this, okay? And he lacks insight about the deterioration in his ability to look after himself and to his daily living skills, okay? When you tell him that, okay, Muhammad Salih, you cannot live on your own, we would be worried that you will leave the door open, you will leave the cooker on, ما حتقفل البوتاجاز، حتولع النار وكده، ودي حصلت قبل كده اللي كان في فاير، انت ما قدرت تعمل كده، انت you cannot look after your finance. في حاجة؟
في زول فاتح الميكروفون يا اخواننا. بليز
قفلت
الميكروفون. يا
قربنا يا جماعة، معلش زهقتكم؟
لا you're okay.
اوكي طيب اوكي طيب لو قلنا محمد صالح عشان نسهل الموضوع، محمد صالح ما بيقدر، المهم هو he lacks capacity, okay, to make decision about his housing or his care, okay, and he's refusing, okay, the plan to go into Dar al-Iwa. Then, and I think that he lacks capacity, things went to court. Muhammad Salih مشى هو والمحلية ولا المستشفى الكورت عشان to decide. محمد صالح, he has a right إنه to have legal representative. Muhammad Saleh needs to have capacity to instruct solicitor. Otherwise, هنا البراكتس في UK إنه محمد الcourt will assign a solicitor for him on his behalf. لو هو عايز يعمل براهو, then you need to assess capacity first إنه محمد صالح has capacity to instruct solicitor. هنا السلايد دي it was written by a judge اللي هو دي بيشرح بالcase laws. Okay. بيقول إنه الواحد if they lack capacity إنه to make decision on their care مثلا on their care ولا هي subject of subject matter اللي هي مثلا care ولا will ولا كده, it will be very difficult for them to instruct solicitor unless حاجة very rare. ليه difficult؟ لأنه what are we expecting when they instruct the solicitor مثلا? Okay, they need to هنا زي دي كده قالك شنو إنهم أول حاجة يكون عارف the ins and out of the case that is going to be discussed في الكورت. Okay, المفروض يكون عارف what is he exactly instructing the solicitor to do. He should be able to give the debate, okay, ولا argument السوليسيتر هيقولوا في الكورت. يعني محمد صالح he needs to give the assurance about how is he going to keep himself safe. الargument ده مش just the solicitor will give it on his behalf. محمد صالح should have a good understanding, okay, of it. So this is how then when I say like then when the capacity to litigate, okay, it's difficult to have capacity to litigate but not capacity for the subject of the matter. Okay, فأنا بس ذكرت أنا زي ما قلت capacity to litigate assessment is big and requires I think a lecture or two on their own just to go through the various steps. This is I know it can be confusing, but even for an experienced psychiatrist, it is not a comfortable area unless you do it day in, day out. Like in my day job, I quite often get to allocate these reports. We call them Section 49 reports, Hina. And they, even like the most senior psychiatrists, they don't feel comfortable preparing them. Old age psychiatrists, they are more like might be more comfortable because they do them more frequent. So as I said earlier, capacity assessment, if you do it, the more frequent you do them, the more comfortable and confident you will be with them. Okay, and thank you. This is the end of my presentation.
Thank you so much, Dr. Salma. Very nice and interesting presentation, الحقيقة. Very nice. Okay, we can open the question for the floor. Anyone would have a question, please come forward. تفضل يا فتحية.
والله ما عندي سؤال معين. يعني أنا بفتكر إنه واحدة من الطرق very difficult للناس بالذات للتريني يعني.
أيوة.
وحقوا الناس يزعلوا يعني. وممكن تكون في اختلافات بين السودان وبين في المشاكل في الحاجات القضائية دي والحاجات دي، يعني بتكون حاجات cultural variation between التو culture يعني. لكن أنا أفتكر ندي الفرصة للتريني يسألوا عن الحاجات دي.
الغرض من عرضي للتو كيس لوز دي كان إنه أوريك إنه these are the kind of like the challenges that you might get in the capacity assessments.
تمام، شكرا فتحية. طيب الفرصة متاحة أبنائنا وبناتنا الترينيز any question؟ لأنه مرات بيكون عندهم مشكلة حقيقة في الشبكة. طيب لحد ما نلقى زول فيهم يسأل عن سؤال يا سلمى لو سمحتي لي برضو. very interesting زي ما قلت وزي ما قالت فتحية it depends on the process of the capacity assessment. It is the same everywhere زي ما قلتي، لكن definitely الامباكت او الفيردكتس اللي بتطلع حسب الليجيسليشن بتاعت كل دوله، حسب اللوز بتاعتهم قوانينهم. في السودان هنا وفي فتره شغلنا بالذات في مصحه كوبر لانها هي تعتبر المين فورنسيك سايكايتريك هوسبيتالز، كان بيرسلوا لنا القضاه من القاضي دائما اللي هو الاسسمنت اوف التستمنتري كاباسيتي، ودائما بيكون خطابهم حتى بنتذكروا هل للمذكور القدرة على معرفة أمواله وممتلكاته، وهل لديه القدرة على التصرف السليم في أمواله وممتلكاته. دائما بيكون السؤال زي ما قلت لك قبل كده إنه بيكون شكاوي كثيرة إنه زول في عمر معين أو حتى يانجو عنده mental problem وابتدى يتصرف في ممتلكاته وأمواله بصورة ما تعجب الفاميلي، فدائما بيكتبوا عريضة للمحكمة والقاضي بيحولوا فور للجنة طبعا في المستشفيات المعترف بها اللي هي تجاني الماحي و طه بحشر فيها اللجنة الطبيعية الشرعية. فدائما بيكون في الموضوع ده. أما زي محمد صالح ده لو قال والله أنا عارف إنه دي hallucinations ودي delusions وأنا ما عايز أسمل وما عايز العلاج، هنا في السودان طبعا طوال 2 من النيرسز بيكرفسوه بيدوها لوبيرادول انجكشنز وما بيزول بيسال كونسنت ولا ما كونسنت، لانه لحد الحسي المنتال هيلث اكت اللي عملناه قبل سنوات يعني ما شغال لغايه حسي للاسف الشديد. فما في حكايه كونسنت تو تريتمنت، كونسنت تو ادميشن، كلام زي ده لسه ما عندنا.
انا كنت سهيت، لكن كنت ناوي اقوله باذن الله لما يفعل المنتل هيلث لو في السودان باذن الله هيكون الترينيز ديل باذن الله هيكونوا خلصوا التريننج وهم هيكونوا يعني putting the act into practice ان شاء الله.
Absolutely. طيب في نقطة برضه مهمة عشان ما يحصل لهم confusion إنه ما نخلط الكاباسيتي بالإنسايت. مهم جدا القصة دي، لأنه لو مثلا قلنا محمد صالح ده فهم من السايكايتريست إنه دي الهالوسينيشنز هي كده وإنه دي delusions وإنه there could be harm to himself or to others وفهم الكلام ده كله وقال لا أنا ما عايز تريتمنت، أنا ما عايز تريتمنت، خلوا الحاجات دي خلوها لأنه أنا متأكد منها حاصلة. هنا الكاباسيتي والانسايت بيجوا مع بعض يا سلمى، مش كده؟ انه معناها يمكن هيز لاكينج انسايت، انه هو ما عارف انه ضمانات، هو صح عارف انه دي كده كده وهي ريتين الانفورميشن وهان كيبس ات ويقول لك ثاني، لكن يقول لك انا ما عايز علاج لانه ده ذاته ما مرض مثلا. فلو وضحت لهم بس الخيط الرفيع بين الانسايت والكاباسيتي لو سمحتي.
اوكي، هنا انت لو جبت 2 سايكايتريست اوكي ممكن يتغالطوا.
يس
اوكي ايوه ممكن يتغالطوا. دي حاجه ثانيه انه capacity assessment can be straightforward. اوكي انه صح والابيض واسود ظاهر كويس. في حتت ممكن انا اجي اعمل capacity assessment اقول he doesn't have capacity، ياسر يجي يشوف العيان ويقول لا هو عنده capacity. اوكي طيب بالنسبه لمحمد صالح قال انا ما داري العلاج لانه دي انا I don't have insight، عشان كده هو رافض. طيب هو رافض العلاج لانه his understanding is impaired. This is my impression will be he doesn't have capacity لانه his understanding of the reason behind the prescribing is impaired. ممكن محمد صالح يجي يقول اوكي خلاص تمام انا اسمي شنو اوكي انا فاهم دي اسمي شنو انا ما مقتنع ان انا عندي سكيزوفرينيا. اوكي انا ما عندي سكيزوفرينيا، لكن انا بثق فيك انت دكتور عبد الغني، انا مؤمنه بك، انا مؤمن بك وبصدقك وكده، يعني انت اللي بتقول لي اعمل انا بعمله. تقوم تقول له خلاص كويس، انا prescribing الميديكيشن الدواء ده عشان انا بليف انت عندك سكيزوفرينيا، لكن انت ما مقتنع عندك سكيزوفرينيا، لكن انا شايف انه ده عشان سكيزوفرينيا، وانا بقول لك انه لو تاخذ العلاج ده هتبقى كويس، وممكن ما تخش المستشفى، وكويس هتتحسن، وما حتتدهور زياده حالتك. اوكي، والسايد افكتس كده وكده. اوكي، هو is able to retain وبقول عشان انت قلت لي كده وقلت كده انا موافق. دي ممكن واحد يقول هو عنده capacity، وممكن واحد يقول ما عنده capacity. وانا اقول لك دي بتحصل لي في شنو؟ في عيانين في الكلينيك. اوكي، عندنا عيانين حاجه اسمها community treatment order، ده لازم نعمل لهم capacity assessment. كويس، يلا ديل ممكن يكون عيان حقي انا عملت له assessment، لقيت عنده هو he has enough understanding okay about the treatment plan و he's accepting medication، ما رافض. كويس، لانه بس سلمى دي قالت له خذ الدواء ده، وسلمى قالت له انه عندك سكيزوفرين، لكن ما مقتنع عندك سكيزوفرين، لكن سلمى قالت خلاص اوكي لان انا بس بثق في سلمى دي. كويس، انا بالنسبه لي this is enough capacity عشان to prescribe. عيان اذا زاد يغير جي بي ويمشي لدكتور ثاني، ممكن يقول لا ده ما عنده capacity.
Thank you so much. فعلا هو ده السايكاتري عموما كده، يعني في variations differences. ممكن someone diagnose this patient as bipolar, another one diagnose it just as depression مثلا، مش كده؟ Patient can have different labels. أيوة يا شباب شابات، anyone would like to ask any question؟
في سؤال من مجاهد هنا في الشات. مجاهد سائل لك سؤال كده معقد كده. Could you explain to us the difference between fitness to plead and capacity to litigate assessment?
الكاباسيتي تو litigate اوكي، ده كان سؤال تخص فورنزيك يا جماعه، انا مسكينه بتاع جنرال ادلت ساكن. طيب الفيتنس تو بليد ده شنو؟ اللي هو ده حيمشي وحيستجوبوه. اوكي، حيمشي وحيستجوبوه هو الكورت، القاضي حيسأل هو. اوكي، الاستجواب. الكاباسيتي ليتيجيت ده اللي هو انك انت تجو ثرو، اللي هو حتعرف انك انت you're going through the court. اوكي، وماشي للانستراكتنج سوليستر وحتقول شنو للسوليستر وكده، لكن مش انت مع الفيتنس تو بليد اللي انت مع القاضي، انت متهم. I don't know whether I have answered your question.
Yeah, it's clear. It's so clear. في سؤال ثاني ياسر؟ بعدين برضه عايزين نسأل ياسر عن الليجيسليشنز اللي عندهم في الكاباسيتي برضه بصورة في أمريكا، عشان نشوف لو في ديفرنس من بريطانيا. طيب يا دكتورة سلمى، usually when you are assessing the mental capacity of any patient, would you explain the purpose of the interview to the patient? Would you tell the patient that I am going to assess your capacity؟ زي ما نحن لما عايزين نعمل forensic report عن البيشنت بنوريه what is the purpose of the interview. The purpose of interview to reach a diagnosis and treatment, or the purpose of the interview to send a report to the court, or مش كده؟ فأنت بتوري البيشنت I am going to assess your capacity ولا ما بتوريه؟
لما يطلبوا مننا ريبورت للكورت، اللي هو ده مثلا سكشن 49 ده، اللي هو ده ريبورت بتاع كاباسيتي للكورت. Yes, بيكسبلين، بنوري العيان احنا this is what we are asked and this is what we are assessing you for. capacity للكونسنت للتريتمنت ولكده ما بنقول لهم احنا we're assessing your capacity، لكن دي بتكون بس عاده البراكتس اللي بيكون جوا الاسسمنت بتاعك، انت بتقوم باسس الكاباسيتي، لان ده بيكون for the purpose of your assessment and for the treatment that you are the treatment that you're applying.
As a clinical assessment rather than for instance. Yeah, very good. وطبعا أكيد برضو you don't assess the capacity of a delirious patient or intoxicated patient، مش كده؟ لحد they get sober delirious patient would you assess the capacity؟
Okay, so again if they're delirious احنا ما ممكن نديهم بس نقول كده it's proven that إنهم they lack capacity we need to assess the capacity. لكن مثلا لو كان محمد صالح جاني intoxicated سكران، اوكي، وانا I want to assess his capacity to make a will. it's not fair
Yeah.
on him إنه أنا أساسي capacity دي حاجة it's not urgent. ممكن تتعامل حاسة دي قبل ما ما نقولش السكرت فيك. ممكن ننتظر كم ساعة and then we do there is no rush. لكن لو كان هو bleeding okay هو bleeding حاجة urgent life threatening I need to make it there and then you assess the capacity لأن حاجة urgency. لكن whatever can wait okay. وتاني الحاجة برضو الاسسمنت of capacity مثلا خصوصا الناس مثل ناس السكيزوفرينيا ولا ناس اللي عندهم cognitive impairment sometimes we assess the capacity not just in one during one consultation. نمشي نجيبهم تاني نشرح لهم نديهم زمن لأنه ممكن مرات عايزين نشرحوا لهم تاني ولا نشرح لأخوهم نخلي أخوه يشرح له وتاني بعدك يجينا راجع نكلم خصوصا مثلا إحنا الأكسنت بتاعنا ما it's not the best. ممكن أقول لهم خلاص ممكن تشرح له وتجي أخلي النيرس تمشي تتكلم معه وتشرح له ويجيني تاني يلا تتست الأندرستاندينج بتاعه. ف take your time okay وميك sure that إنك أنت يعني استعملت كل المساعدات الممكنة الممكن كل الأيدز الممكن تساعد العيان ده لأنه to have better understanding ولا كان able to communicate better كده عشان before you declare إنه هو conclude or he doesn't have capacity. الناس اللي learning disabilities تستعمل صور تستعمل حاجات too easy like aids to help them to understand the subject of the assessment.
Yes أنا حقيقة سألت السؤال ده لأنه بتذكر لما كنا ترينيز حسب في أيرلند Saturday night ده طبعا بيكون very busy night في الأكسيدنت and emergency وبيجوا سكرانين واللي بيقول أنا عايز أقتل نفسي واللي بيقول أخذت أوفر دوز هناك فطوالي هم ناس يعني إيه بس يتصلوا بالسايكايتري ريجسترار اون كول والله عندنا بيشنت فبنسأله سؤال واحد في التليفون is he intoxicated؟ يقول لنا yes نقول له keep him until he is sober. فكلنا بنرتاح الليل كله إنه يقعدوا ما عنده في يعني إيه لحد ما يكون sober just for mental state examination. نقول له we cannot conduct a simple mental state examination when the patient is intoxicated. يعني ما بس capacity حتى المنتال state examination العادي ده ما كنا بنعمله الحقيقة لحد ما البيشنت يكون sober.
أيوة.
تمام شكرا لك. شباب في سؤال عندك يا ياسر جاك؟
ما في سؤال بس هستنى انا عندي اضافه لكن هستنى اذا في سؤال من الشباب اول حاجه بعدين ممكن عندي اضافه اقدر اقولها.
الان احنا عايزين نسمع منك ومين وايل لو جاء سؤال خش بعدك في السؤال تفضل.
طيب هي كم حاجه بالنسبه للموضوع بتاع الكاباسيتي لانه امبورتنت. اول حاجه ليه احنا بنعمل assessment of capacity؟ why do we even think about it؟ لانه the alternative حاجتين يا اما انت you leave the patient يعني decide for themselves and make bad decisions or you take over completely واللي هي حاجه بتتناقض مع حاجتين. انت في الاخر البينيفيسنس دي هي ethical concepts انه في الاخر انت الليل العيان ما ممكن تخليه يعني يقوم يصوت الدنيا براه and make bad decisions that can impact them or impact people around them in a very negative way. ولا الحاجه الثانيه انت you cannot be paternalistic. انت you cannot force your opinion on the patient. انت شايفه صح وتحمل الليله تماما راي العيان. فدي انت because you want to take the patient's opinion into consideration and assess if he's able to make that decision and then make a decision, make an assessment whether the patient is capable of making a decision for themselves or not. ثاني حاجة when we make مثلا medical capacity, when we assess the capacity to make medical decision, it is one medical decision, at a particular state of time. يعني الليلة if we made an assessment الليلة العيان he cannot refuse to take chemotherapy. He might still retain capacity to make decision about surgery. It's one decision at a time. ما عنده علاقة. وبعدين تاني حاجة إنه there are many variable things that can affect capacity. So the patient might have capacity today, might not have capacity tomorrow. It's a very fluid term and it depends on the state of mind at that particular time. ما حاجة الليلة نقول العيان ما عنده capacity معناها ما عنده capacity forever ولا ما عنده capacity for every medical decision. They can make
شكل تاني نرجع له بكرة تاني to repeat the test.
Exactly. ثالث حاجة اللي لما مثلا احنا when we treat patients احنا we assess capacity on everybody لكن capacity is assumed. يعني عشان كده انت you don't assess capacity unless there is a reason. You don't assess it formally unless there is a strong reason. انت you think the patient is not in a good like there is a reason when you need to assess capacity. حتى مثلا الليله the decision has to be really relevant in order to assess it. احنا الليله مثلا لو عندنا عيان he has an abdominal pain والinternal medicine physician they want to do an ultrasound. العيان قال ما حعمل ultrasound، كانت السنه انطبقت على الواقع. ليه؟ لانه الالتراساوند بتديني مثلا waves حتدخلوني حتى into you control my mind. وانت عندك other alternative انك تعمل CAT scan and the patient is okay with this. احنا ما حناخذ الموضوع it's not going to go to the standard even if the patient does not have capacity. We don't go and overrule his decision لانه it's not an emergency. A decision not emergency. فاحنا okay حتى is making a bad decision, the outcome here is not going to affect the patient. Let him be. You don't overrule his decision unless it's an important decision. يعني مثلا الليله العيان عنده chest pain مش الامرجنسي، رفض ياخذ رفض قالوا له نعمل لك كاثيتر، قال لا انتوا you're going to insert a chip in my mind, you want to control. احنا we have a time limit, we cannot wait. So that's a decision that is worth assessing capacity for. لكن abdominal pain وانت عندك alternative ولا حاجه ما emergency, let it be حتى لو ما عنده capacity. You don't overrule his decision at this point.
Yeah.
Yes, definitely دي تعتمد على الكالتشر وحرية الإنسان وحقوق الإنسان والكلام ده. يعني زي البيت كاري اللي قلتيها يا دكتورة سلمى. لو أنا شخصيا ما أعرف، لا يمكن أسمح لها إنها تقتل نفسها حقيقة. يعني بشوف الديسيجن ده غلط. كاباسيتي ما كاباسيتي هنا حسب الكالتشر بتاعتنا وحسب الليجيسليشنز بتاعتنا. definitely we have to interfere and try to save her life. يعني ومن أحيا نفسها من أحيا الناس جميعا. نحن ماشيين بالقاعدة دي.
أنا دائما بقول للترينيز بتوعني، بقول لهم إنه when you have like such situation, think about where do you want to stand? Do you want to stand in front of coroners when you did not intervene and your patient died, or when you do intervene, your patient you save your patient and then patient takes you to court? So which one? So where do you want to stand? And just go with it, and you'll like just save the patient.
كلامك صحيح. اصلا ماشي المحكمه احسن انقذ حياه في المحكمه.
بالضبط كده
يس
بس للتكمله انا هحكي لكم قصه this person experience عيان كان عندي قبل 3 سنين تقريبا. عيان ده كان هو بتاع سكيزوفرينيا، chronic schizophrenia with residual symptoms, treatment resistant، قصص شديدة. العيان ده كان عنده هيدروسيل. Okay, فهيدروسيل over the years كان for number of years، لكن في السنين الأخيرة الهيدروسيل بقى كبير، بقى أكبر من كرة القدم. لدرجة إنه they had to adjust التراوزرز تحته، يعني خيطوا له زي حاجة زي تشبه السروال اللي عندنا السوداني عشان يعني to serve his dignity وكده.
حتى المشي يكون صعب. المشي ساكت. المشي ساكت قلت لك إنه
المشي بقى مشكلة، السلف كير بقى مشكلة، كله بقى مشكلة. فقام العيان ده يا زول حلف قال أنا ما بمشي لليورولوجيست، ما في زول يبيش الهيدروسيل ده. ليه؟ قال يا جماعة أنا زول، أنا big man وكده، أنا I have كده يعني I have big balls، فكده أنا ما هحتاج ده كده ده أنا كده. يا زول لا، تاني أنا وأساسا وحبة بارانويا كده على اليورولوجيست، نغير لك الزول، نغير المستشفى، لا أوكي. فقمت ناديت اليورولوجيست وشفناه سوا، حلف ما يشوفه. طيب نعمل له درين، نعمل له كده، لا اوكي. احنا الكونكلوجن كان he doesn't have capacity, he did not have capacity. اوكي ومشيت اوكي يلا قلنا خلاص he did not have capacity، ودي كل المشاكل بتاعه. يلا it's a surgeon decision whether they want to go ahead to operate against his decision with his best interest ولا لا. And guess what? He did not operate on him. ليه؟ لأنه قال لازم تبقى life threatening. عشان تبقى life threatening there is evidence إنه this is cancerous or infection وفي risk of sepsis ولا في skin lesion ولا. فقمنا عملنا له tumor markers negative، عملنا له inflammatory markers negative، السكين ليجن ما في نبتة سكين انفكشن وخليناه. فthis assessment of capacity يعني it was obvious يعني كده، لكن it's not life threatening. Still they respected his wishes, although we knew it was all driven by his psychosis. وأي حاجة، وأنت لو ده أخوك ولو أبوك عايز دعم يخليه كده، لكن still respected his wishes and it was not operated. هو مات، لكن مات لسبب تاني.
سبب آخر، لكن ما مات مرتاح يعني. طيب عشان كده ده والله يا سلمى ويا جميع المستمعين بيطرح سؤال مدى مساحة الحرية الشخصية، مش كده؟ هم بيعتبروها حرية شخصية، لكن نحن عندنا حدود للحرية الشخصية الحمد لله، والحدود دي يعني معروفة كالشرعي ودينيا، مش كده؟ فالقوانين دائما تفصل كده، جماعات حقوق الانسان هنا، واحتمال انت ذاتك لو مش عامل له العمليه وحصلت اي حاجه يجيبوك يتلتلوك وتلتل عندك انت were just trying to help him، مش كده؟
برضه مثال الكباسيتي بس عشان نختم لو ما في اسئله. حس عندنا في السودان الناس اللي ساكنين في الخرطوم، مش ساكنين في الخرطوم، الناس ساكنين في بحري هي الاكثر افكتد. اوكي، حلتنا يا عبد الغني، حلتنا في الصافي. في ناس قاعدين في نص الضرب ابو يطلعوا. هل they lack capacity؟
a big question والله. ايوه، في اي اسره في زول زي ده يا سلمى؟ في اي اسره؟ انا في اسرتي في زول زي ده.
زول فينا فيه اسره، فيه زول ولا اسره اصروا وقالوا لا، لكن مين عندهم هم they lack capacity؟
لا، انا التشخيص قوه راس، ففي ناس سودانيين عندهم قوه راس عجيبه، مش كده؟
لكن انا ما عارفه هل التحضير زي ما قلت دي اول مره ادي محاضره للترينيز بتوع السودان. وانا كنت بحضر امبارح كنت خايفه ان انا اكون it's too UK practice driven lecture، لكن عارفين ان عشان كده ركزت بس على الكاباسيتي assessment rather than عن what we do اللي هو البست انترست ولا كده اللي حيتكلم عنها ياسر اللي هو لكن حبيت اخذت الكيس لوز لأنا بس بوريك examples عن what is say. اكيد زي كاري دي حيكون في واحده في السودان، حتكون في وبس بانكس حيكون محمد صالح ممكن يكون في السودان او في اي حته احنا بنمشي فيها ان شاء الله.
absolutely right. بالعكس انا اعتقد وضحت لهم الموضوع زي ما قالت فتحيه، موضوع شائك جدا ومهم جدا للترينيز، وانا متاكد ان هم لولا المشاكل التقنيه كانوا interacting معك. لا في اي حاجه ثانيه يا شباب؟ ياسر، فتحيه، اي زول عنده حاجه قبل ما تكونكلود؟ مسكنا سلمى كثير الليله.
اي مشكله.
لا بس انكارجمنت، انا عارف انه هنا الشبكه مثلا للترينيز ما ممكن يعني ممكن تكون شويه ما خالص، لكن انكارجمنت يا جماعه اسالوا اسئله، ما في سؤال ما كويس ولا سؤال كعب ولا سؤال ما ظريف، اسالوا.
بالتاكيد والله، اي سؤال حتى كومنت، يعني ما كلنا بنسال، احنا في اي we always benefit، يعني احنا بنسال اسئله احنا ذاتها ما عارفين اجاباتها بنسالها وسلمى بيجاوب لنا يعني. فاي زول
بس
في اي
اتذكر انه يعني حتى احنا عندنا زي ما قلت انه لما allocator try to allocate a report بتاع capacity assessment يعني ممكن يكون experience psychiatrist بالنايبر تقول لي لا انا عايز I need help، ولا ادوني report example لي. فانا عندي في الدرج بتاعي عندي example بتاع report عن كل واحد كده، عندي شكل، عندي واحد anonymized report برسله عشان شنو؟ عشان ياخذوا فكره او تريفرش. فهو موضوع شائك زي ما قلت، يعني ما فيها right and wrong، لكن as far as you follow the two-stage test ما قلنا و you're able to explain and justify your decision making. ممكن لو زي ما قلت حس لو جبنا لياسر دكتور عبد الغني قلنا لهم شوفوا نفس العيان they might come up with different decisions as far as you are able to justify your clinical decision. like كاري مش حتكون مستغربين في الكورونرز ده ليه مشى وكده، لا لانه that is was Dr. Heaton's decision and impression at that time. ما بصدق يغلطوا.
نعم you are absolutely right. نعم ممكن طيب دائما في السودان الحاجات زي دي بتكون في كوميتي لكاباسيتي، بالذات التستمنتري كاباسيتي. انتوا just one psychiatrist can do it ولا you need 2 or 3 psychiatrists together to reach a decision؟
لا بيكون واحد. بيكون واحد، لكن هو زي ما بيقولوا فحصوا محصول السوليسترز في الكورت.
ايوه في المحكمه.
لو مشى لو انت لو الريبورت بتاعك ما ديتيلد وما مقنع ممكن ينادوك في المحكمه، لكن لو الريبورت مقنع ما بنادوك.
يس.
اي مرات كده بيقوم يلا السوليستر بيطلب independent opinion مرات، لكن ما فيش اثنين بيقعدوا بيعملوه. not to my knowledge.
ايوه، لانه في السودان بيحولوا طبعا للفتنس تو بليد اكثر حاجه، والكريمنال ريسبونسبيلتي، والحاجه الثالثه التستمنتري كاباسيتي. يعني المحاكم دائما بتحول للثلاثه حاجات زي دي، لكن بيكون في كوميتي. اتس نوت وان سايكايتريست ديسيجن، بيكون في 2 or 3 سايكايتريست هم اللي بيكتبوا، لكن بعدين القاضي بينادي واحد بس، اللي هو بيكون في واحد هيد اوف ذا كوميتي ومعاه 2 ممبرز يعني. وزي ما قلت المحامين بيكونوا قاريين القصه، حتى في السودان بيفلفلوا زول فلفله شديده خلاص.
هنا الفتنس تو بليد والدايدل كلهم بيعملوا نفس الفورنسيك زي ما قلت، عشان كده اريا اوف اكسبرتيز. لكن الكاباسيتي وهنا سبحان الله مش الويل، لكن لانه الويل ده بيعملوها المحامين وهم يعني عندهم their own process، يعني بي make sure that انه في capacity assessment done، لكن if needed. لكن الأكثر حاجة يعني سبحان الله طبعا عشان ما عندنا العائلة الممتدة والترابط الأسري زي السودان، بيكون هنا أغلبها على الكير، اللي هو لو إنه يتحط في المريض أو الشخص في دار إيواء.
هوم كير. أيوة.
هوم كير ولا فدي أكثر حاجة هي بتطلب مننا.
في السودان بقت كثيرة يا سلمى في حكاية الورثة، والله بقت كثيرة. وزي ما أنا قلت لك في الدسكشن بيناتنا، يكون زول كبير في العمر كده قدر ياسر يمشي يتزوج له بنت صغيرونة عمرها 18 سنة، وياسر يكتب لها ممتلكاته كلها طوالي زوجته وأولاده يجيبوا ياسر فور كاباسيتي أسيس. ترد شنو يا ياسر؟
اللي يقولوا ما كان شاركه وقت العمل الهناي.
عارف حكايه كتابه الاملاك والممتلكات كثيره كانت بتحصل، ويقولوا ابونا ده خرف وما خرف، قصه طويله غايته. افتكر it was very very nice والله وانترستنج، وليله جميله. نكرر شكرا لياسر، يعني بيقوم بعمل كبير والله، وشكرا للدكتوره